Wow. This is like looking in a mirror, watching this video. Got a psychologist reviewing another psychologist on the screen behind him, interviewing Cory Taylor from Slipknot about his past life traumas and stuff like that. What are we, 8 minutes into it so far. Right, I'm going to play it in a minute. One of the questions he's been asked so far, what was your drug of choice to deal with all that trauma? I'm going to give my answer first, right? Because it was the same drug, speed. Where you speed your brain up so fast that it becomes numb and you can't think. Or you can stay up all night fucking about, dismantling stuff, making stuff, being very creative. Having sex all night. It's all a distraction, isn't it, really? So let's press play. Something to do with Cory Taylor's childhood traumas, and that's what started his drug problems before he went into music and found a positive outlet for it. So let's just watch this. But it is like looking in a mirror.
Hyper tentative, hyper protective, and I don't know.
It maybe also contained within yourself because you had no safety. You couldn't share.
Yeah.
So you had to hold a lot in.
Yeah.
And it had to go somewhere.
Drugs.
Mm-hmm. What were your drugs in the past? What were they?
I was a speed freak when I was a kid. Yeah, like I could stay up and I could run.
Motorhead.
So that was an example of a closed-ended question where you want to know something specific. You want to know what were your drugs in the past. So not tell me about drugs or something open. He said, what were your drugs? So that was kind of a very specific question that he wanted the answer to.
In researching men not raised with their fathers,
Roxy's happily
there's a term
playing.
that is used, half alive. The father can ignite something in the son that the mother cannot.
Talk through that bit, missed it.
Interesting. Okay.
So, like, for example, in African culture, they take the young teens, the elder men.
Drugs.
Mm-hmm. What were your drugs in the past? What were they?
I was a speed freak when I was a kid. Yeah, like I could stay up and I could run and I could go.
So that was an example of a closed-ended question where he did want to know something specific. He wanted to know what were your drugs in the past. So not tell me about drugs or something open. He said, what were your drugs? So that was kind of a very specific question that he wanted the answer to.
In researching men not raised with their fathers, there's a term that is used, half alive.
Half
The father
alive.
can ignite something in the son that the mother cannot.
Interesting. Okay.
Got it.
So, like, for example, in African culture, they take the young teens, the elder men, take the teen, the male teen away, and they put masks on and they do all these rituals and they scare the demons out of them.
Really?
So you had no male principle there to deal with the demons inside of you.
Yeah.
So then you acted them out.
He's getting pretty animated there, and I would say that he is somebody who he blends approaches, the therapist. He blends
Similar
approaches
in
and,
Turkish culture as well. When there's a
one that he tends
divorce,
to
the
draw a
male
lot from is
childs
what you
go
would
with
call
the fathers,
psychodynamic therapy.
and the
So these are
female
therapies
childs
having
go
to do
with the mothers.
looking
That's
into
the
your
law in
childhood,
that
how
country.
events from your childhood shape the way that you experience the world now. And so part of that, once you're able to sort of get into somebody's subconscious a little bit, hear the way that they talk about things, the way they interpret things, is making your own interpretations, having sort of these hypotheses and bouncing them back at the person. And so that's kind of what he's doing here. He's saying that, his hypothesis is that since he didn't have this central male figure to help balance things, he had to do that himself. He had to create that balance. He had to kind of expel those demons in his own way. One thing that I will say is that sometimes making a bold claim like that doesn't always have to be right. It just has to be productive. So say there are a lot of people who, when he starts talking about, a father can ignite something in you the way that a mother could not. Some people would feel sensitized by that or offended by it or disagree with it based on some, educational principle they know.
Just get up, Roxy, because I'm listening to
But
this.
in this case, I
I'm
think he
finding
picks
it
up on the fact that
educational
that may
as
be
well.
something that Cory would agree with, would resonate with, and he's throwing it out there with the hopes that it would be productive. So even if he doesn't fully agree with it, it's going to be a conversation that leads somewhere where they're going to get to that deeper understanding.
So unloading it is right, isn't it? So rather than keep it within, you get it out your system and move on.
In your life on a consistent basis.
Yeah.
So that's why they say half alive.
Interesting.
So part of you was dead.
Then you get all the mother's negative projections that
That's just a
way.
bold ass thing to say to somebody. Part of you is dead, and I appreciate that in a way, Just
Once
throw
you
it
cut
out there
that
and
link,
let them react to
it's
it.
gone. You've only got
You
the
spoke
father's
up, but
influence
nobody
then, which is
heard
positive, because
That's
it's
why
the
the music's
male
so loud.
and you're a male.
It's like this cacophony of sounds that has almost a war experience.
To me, it's like this. It's
Hence
this
teaching a
barrage of
child
music,
not to fear,
and it's like creating a message out of chaos.
because it's somebody
like
else's
reaching your hand into
psychosis,
white noise and
not
pulling out the
his or
exact
mine.
message that you wanted to convey in the first place.
So
there we go. He provided an interpretation. It didn't fully hit the mark, right? He said, I think that you create this loud music to sort of be heard. And Cory's saying, he's kind of saying maybe, but I'm making this loud,
All right,
cacophonous
Roxy,
music
let me
so that I
watch
can
this,
find
please.
that thread through it and make sense and order that
Good
chaos. So that's a way where kind of a not fully correct interpretation can lead you down to that deeper point of understanding.
these lyrics and more of the lyrics. The song Father, of course, just...
That came from a really heavy spot.
So talk about your relationship to self-harm.
Fantastic open-ended prompts. So rather than saying, have you been harmed, the person would say yes or no, or they may say, I don't want to talk about that. So him saying, talk about your relationship to self-harm, that's very open-ended, gives him room to explore, gives him room to talk about what he's comfortable saying. You can feel out if he's holding
I'm
back or
thinking
not.
of myself
you can see sort of
and
just how he
another
reacts.
child
And
of
so
mine in
whenever
the same
possible, it's
situation,
more
going
useful,
through the
especially in
same
this
thing.
exploration stage, to use those open-ended questions or prompts. It doesn't always have to be a question. I'm a big fan of the prompts. Tell me about this, or talk more about that sort of thing. So that's what he's doing here.
A lot of me went with it. I felt so empty that I had a hard time feeling anything other than grave depression. And it was the one time I really was just like, I can't handle this.
Well, I hear a lot today. I hear that you finally found your heart pulsating. And when she left, you were left with what was there before she came.
Yeah.
So great, fantastic, like restatement, right? So taking what he said, encapsulating it into sort of a smaller package and reflecting it back at him. Restating basically him saying that he found something in this person and then felt like he'd lost it, so a sense of loss there. So reflecting back what you think the person is saying, often saying what I'm hearing is, or what I think you're saying is, or something like that, is a really great way for them to feel understood. And then again, that invites them to go deeper. If I'm hearing his intention as well, there's maybe a little bit of a reframe going on, that not only was this just all tragic and a big loss, but it's something where the reason the loss was so impactful is that he found a little bit of the potential.
I've seen this sort of thing
his
in
capability, that he can feel something. He can have this part of him ignited.
another family member
That's why
as
it's so
well,
painful when it was ripped away.
worrying
So
and
that's sort of
panicking
opening
over
up
the
another
child.
line of
And
inquiry and
then
another
it's
place that
really
you can go
somebody
down if you wanted
else's
to.
projection
My
that's
grandmother
causing
has
it all.
been the one.
But I'm actually
person in
trying
my
to help
life.
both those male relatives,
She came and picked me up, and she was
because I've been through it myself.
so disappointed.
I can see it.
These are, I know he's
see it
getting into
repeating.
emotional territory. You can see him sort of welling up, accessing that emotion now. And these are really powerful moments where you see him kind of looking wistfully, like right
The
now.
fear of losing,
Cory
innit?
he's there in his mind. He's imagining what happened. So this is something that, when you have memories, especially ones that are traumatic or just really, really impactful, you store them along with these sensory cues, meaning what did it look like? What did it smell like? What did it feel like? And so he's sort of getting back there. And for somebody who is, has maybe PTSD, something like this sort of recollection would be really, really tough because they would feel like it's happening to them again. I don't think he's there with this. I don't think he's re-experiencing it, but he is almost
Put someone in prison
peeking
at
in
that
the
point,
room.
and it's the
This is
worst
really
thing
silly,
you
but
can do to the
there's
person,
the scene
because it will flip
what was it?
them.
One of the Avengers movies, Civil War, I think, the Marvel Civil War movie, where Iron Man has those glasses that sort of, is it glasses? I don't know, but he projects a scene from his past.
And then if the person's
paints it
been in
onto the
control of
stage
their
and plays it out, and that's
self
really
up
what's
until
going on
that
here.
point,
Is if you look at it, you can almost
what
picture
comes
the
after
scene that's
that,
playing out in front of
when
his
the
eyes. And
retribution
that's really, really
comes?
powerful territory that you can work with in that therapy session.
Well, I don't have to spell that out for you, do I?
I could see it on her,
Right.
and it was almost like a race of emotion. She was disappointed. She was glad I was okay, but she was so mad, and that killed me. It hurt so much, and I didn't like it. Almost put me over again. That I immediately just said, "Okay, it's not." It's not something you come back from.
Really good. He's probably about to say something, but he gave him a lot of room to feel that. When you're with somebody, when you're sitting with somebody who's hitting those deep emotions and is talking about something that was hard for them or traumatic for them, it's really easy to become uncomfortable as a therapist, and it's really easy to feel like you need to jump in and save them or release the tension in that moment. But having some silence and letting them feel that, giving them the opportunity to feel it is really, really important, because sometimes that is what they need. Rather than avoiding those thoughts and running away from them, they need to allow themselves to feel them. And what better place than in the room for therapy?
Childhood sexual abuse, that would be even though you weren't touched.
I wasn't by my family.
Oh, okay.
I was raped by someone in the neighborhood. It was an old
How old?
So I hate to interrupt that particular story, but so there, I wouldn't say he made a mistake, but you got to be careful about making an assumption, right? Saying, "Oh, you weren't touched." He doesn't know that just didn't come out yet. So you might say something like, childhood sexual abuse. You talked about these things. I haven't learned yet whether it's gone farther than that, and you might leave some space for them to fill that in or not, and then continue on if not, or whatever the case may be. But making that assumption is something you need to be careful about. And sometimes the way you ask something is really important. I find that a lot of medical doctors have a little bit of a hard time with this, where they say, "Okay, so I'm assuming no history of this, none of this going on." And the way they phrase that makes you think like, well, okay, so you're telling me I shouldn't have that, right? So of course I'm going to be a little bit more guarded. So the word choice is something that you really have to pay attention to.
Forward. 10.
How old were they?
16.
Well, that could attribute to a lot of the acting out behavior.
Yeah.
I never really knew where it came from until you shared that. I knew Dad wasn't there and Mom was unstable, but that is a severe psychological wound, especially for a young man. It's very damaging to the psyche.
So he's again making a pretty strong interpretation there. It's not unreasonable to suspect that something like that would have a deep impact on you. And I think he's assuming that at this point, as they've kind of collaboratively weaved this story together in the therapy session, the fact that did come out spontaneously is something really, really important. And so in his mind, he's drawing the link, between that to the acting out behavior, and that's something that he feels is
Someone's
quite
watching
important.
my reactions
That
very
could or could not be
closely.
the case. I think it's a pretty safe bet, but of course there are people who are very, very resilient to certain types of trauma, And it just may be that that particular trauma wasn't the most impactful, whereas another trauma was. So, it's something that I think you need to make sure that as a therapist you make that interpretation, throw it out there, see how it sticks, and play with that. But you also need to remain open to the possibility that you're not totally correct about that.
Today, that feels like
Go on, snuggle up.
the head on the nail
I know you want
of
to
the
check.
original cell
Snuggle up.
from which all of your symptoms,
Snuggle up.
your drug addiction, your masking,
No, you can sense it.
your trying
Lay
to
down
give
then.
your heart to someone, them abandoning you.
Lay down.
Again, you felt
There's a
like
good girl.
you trusted someone and they,
Yeah.
All right, you're making the camera
So-
wobble. Pack it in.
About, and it's striking a chord. You
that's
see in his
the
face.
work. All of this other stuff is symptom. So you are a rape abuse survivor.
Well, there's no heating on at the moment because I've turned it off. But it's
If
triggered
you
something within.
need to go to a survivors group, a sexual abuse
And the
survivors
heat's building
group,
and
then they help
building
you
and
continue to
building.
release that. That's
Not
that's
from
how
a
this symptom came about.
sinus thing,
So continuing to kind of drive that point home.
but the inner
continuing
energy is
to provide
waking
that
up because it's
interpretation,
reacting to
I
something.
think him saying you're, a rape abuse survivor, shooting that identity toward him and seeing how it lands is something that's really interesting. And from the look on his face, it's something that Cory hadn't considered before. He didn't think of himself that way. And so sort of trying that hat on and seeing how that affects the way that you perceive what you've been through and what you're feeling is something that is, at the very least, quite interesting.
Yeah.
I
never even thought about that.
Yeah, that's there it is.
It's heavy stuff. That's going to go beyond one session to think about and chew through.
Just close your eyes for a second and just and pucker your lips, inhale through your mouth. Exhale through your nose. We're consciously breathing. It's very private. I'm not going to ask you anything to share that you don't want to. But please have the experience while we're here of healing this wound. And all of your subsequent, I'm sure you became sexually promiscuous at times. I'm sure you had periods to where you didn't want to be touched.
His eyebrows, definitely, that one.
I'm sure you may have had periods to where you felt sexually inadequate.
That one too, yeah.
Go through that now.
So he's inviting him to do some exposure work. Exposure isn't always being exposed to something. Exposure
7
is a term
minutes left
for
of it, so I'm
approaching
just gonna let
something
it run.
that causes anxiety or discomfort rather than avoiding it. With traumatic memories, avoidance is the biggest
6
thing
minutes
because
left
we don't
on
want to
the
think about it. It sucks to think about it.
video.
Makes us have flashbacks, all these things, but that makes it bigger and more powerful. And so when you
Record
have somebody
time.
in a situation like this where they are feeling strong enough and safe enough to start to approach those things, you can invite them to do some of this exposure work. And so he's, in this case, allowing him to do it in his own way, saying just have that experience while you're here, while you're in the safe space. And that can be corrective. There's this term corrective emotional experience where, you get to paint a different narrative of the emotional experience than you could before because you're in this different setting. And that will allow you to,
My way of
when
thinking.
you take out that memory, put
You
it
can
back
go to a
into the memory
therapist,
with these new understandings. And the more you do that,
which
the less
is a doctor. In
threatening
this
that
country,
old
it's all
memory is
run
gonna
by the
be.
NHS, which is
So this is good
government
stuff.
crown
Leading
again.
with the breathing is a
So
great way
if
to do
you
that.
expose your weaknesses to them,
And feel what you see. Don't run away from
you
it.
can guarantee they're going to use it against you.
See that little boy there.
So why not use a video like this to heal
The
yourself?
little boy heal.
Cut out the middleman. Then no one can use it against you, can they?
He's
No
allowing
one
him
can
to have his
take
own
your children
intros.
away from
This is
you or
getting me a little
anything
bit.
else.
He's allowing him
You're
to have his own
literally healing
internal
yourself.
sort of discussion about this. He's not telling him what words to tell that little boy. He's saying, see that little boy and allow him to heal. So in Cory's mind, he may be saying something like, he could be apologizing to that little boy. He could be saying, "I'm sorry." He could be
All right,
saying, "I
Roxy,
forgive you."
calm
He
it
could be saying
down,
it wasn't
mate.
your fault.
I'm
Whatever
all
it
right.
is, that's something that's sort of naturally happening internally, and that's something that the therapist doesn't need to hear necessarily.
Open your mouth wide just for the last few seconds. Then through your mouth. Through your mouth. Go through the paranoia, the pain. Go through it as much as you can. Live it, see it. You're releasing this
Spit
stuff.
it
I'm
out.
not sitting you get it. I'm trying to get it out of your psyche. Let it go. Let it go.
It's like emotional bloodletting.
You just get to work. Let it go. Let it go. Just breathe through your nose. Let it go.
Now, for anybody that's scared about potentially doing something like this in therapy, this is something that, this would not be first session work necessarily, like I said. And Cory is somebody, like I said, he's been through a lot of life. He's very open about
Imagine
these things.
having a
He can pick up a lot through music
narcissistic
and lyrics that
family
he writes.
member
And so I think this therapist has the understanding
that
that
tries
this is
to
a very
trigger
resilient,
those
psychologically
responses that she's
strong,
found
open
out
person to have
about,
survived all of this,
and then keeps
and
using
that
it against
he can
you
withstand
every
an intervention like
opportunity when
this.
you raise
In
your
general,
own
we're
spirits,
getting toward the end of the video
lift
here. This
yourself
is
out
something
of that.
you need as a therapist. Do you want to open up this can of worms and then just kind of leave the person hanging, or is it something you're going to be able to kind of bring them up and then bring them back down?
Because it's a good way of getting
you'll
back
work
at the
with
father,
them
isn't
sort
it,
of
that
push
hurt
out
them.
and continue that process in a way that's not overwhelming and really detrimental. So I think that this is, he's obviously been doing this for a very, very long time. Some of these things are
Basically, the
really
mother
masterful that he's
always
doing, the way
projects
he's
it
picking
back
up
at
on
the
some of the subtle cues.
other
So
parent through
I
the
think
child.
that he understands that this is something that he can handle, but that is something that a therapist is be aware of. And if you're going into, say, therapy or trauma-focused cognitive behavioral therapy, you're not going to be just slammed with this sort of thing right away. So don't be afraid of that. Just let them come down. Let them come down.
It's crazy when you walk in, you think you are pretty aware, pretty awake, pretty in tune, and all of a sudden you realize that maybe there were bits of you that were very much asleep.
2 minutes record
And
time left.
suddenly those nerves are awake, and your mind is awake, and you've seen things that maybe
Yeah,
you
you've
only
had to
saw when you
relive
were
things.
asleep. So I think that's very, very fitting.
They're talking. He's essentially talking about the unconscious or the subconscious, and that's the playing ground, and that's the main focal point of these sort of psychodynamic or psychoanalytic therapies. These are stemming from Freudian therapies even, and so by hearing what Cory says, reflecting certain
And
parts
if
of the
you've
practice,
got a
and
narcissistic
learning,
family
letting them
member,
explore, and then making these interpretations.
whenever you try
you
to
start
break
pull
free
out
from
pieces
that,
of that
they will
subconscious,
try
those threads that are
to
there but are not
affect
necessarily
you
on the surface that he's
to
fully
stop
aware
you
of.
breaking
You bring
free
those out into the
and
light and
scapegoat
become
you
aware
and
of those
isolate you
subconscious
and,
needs or wants, desires, things like that, and that's part of the process that's healing.
affect the things
I
that you
suspect
love.
that he would, Cory would say this was a very healing experience for him.
I guess our journey has come to an end, and I look forward to greater things and more success, and I hope you got some resolve today.
I feel pretty good about that.
Okay.
Yeah. Cool. So that was really cool. I think I would love to watch more of these. It's the first one of these that I've seen. I think there's a series where they're doing this with other people, and I think it's a great sort of insider view into what therapy can be like. I think
Must
it's important
admit,
to
it's